The occlusogram is a powerful tool that allows you to analyze the patient's occlusion. The contact and distance between opposing teeth are displayed on a map according to a colored legend. It is used for assessment and preparation of treatment plans for orthodontic, hygiene, and restorative purposes. The occlusogram can be used to analyze occlusal forces in the bite distribution and to visualize potential increased risk factors of occlusion trauma, such as gingival recession. Additionally, doctors can check if prepped teeth have sufficient reduction and use the occlusogram to effectively present clinical findings during patient-doctor communication. The occlusogram can be accessed via the orthodontic or restorative flows and from the viewer for existing scans. In the orthodontic flow, after performing a complete scan, including bite, tap the View icon. After the images are processed, to view only one arch, tap an arch to remove the one you do not wish to view. Next, tap the Occlusogram icon. The occlusogram demonstrated by the color map displays the clearance between opposing teeth. The color legend displays the default scale. Tap Scale to change these values. In the restorative flow, after performing a complete scan, including bite, tap the View icon. After the images are processed, the occlusogram appears automatically. The color map demonstrates the clearance between opposing teeth. The color legend displays the map scale. Tap Scale to change these values. This enables you to assess whether there is sufficient distance between the prepped tooth and the opposite tooth as required for the material selected in the RX. If necessary, use the eraser tool to delete the area of occlusion. Reduce the prepped tooth and rescan that area. Before a scan is submitted, the occlusogram can be accessed on the iTero scanner only. Previously submitted scans can be accessed from the scanner and the myitero.com portal. To view the occlusogram for a previously submitted scan, tap Patients in the home screen. Select the required patient name from the list, then tap Viewer. Tap the occlusogram icon. To view the occlusogram on both arches in the same screen, tap the Occlusal View button. To view only one arch, tap an arch to remove the one you do not wish to view. The color map demonstrates the contact or clearance between opposing teeth. The color legend displays the scale, with red indicating full occlusion. The occlusogram is a simple, effective tool for assessing occlusal contacts and clearance. It also indicates the distance between two opposing arches for prepped teeth in restorative procedures. It can serve as a credible visual aid for communicating with patients about existing and predicted conditions.
It starts with iTero.